It's on tape now, ready?
Yeah, I think it's recorded. Recorded?
Okay, everybody, welcome. May I have your attention for a minute to give my good friend and colleague, Dr. Nachum Klafter, an introduction. First of all, just a couple of housekeeping things. I'm going to say it, even though there'll be different levels of compliance, but please consider very seriously shutting your phone off or putting it on silent. If you want CEU credits, you need to sign in. There'll be a sign-in sheet over here if you're looking for CEU credits. And also there's going to be a packet there's going to be feedback forms at the end of the presentation. We really appreciate that you sign, because when we get information about the presenter and how you felt about the presentation, it helps us figure out what you might want to learn next and what we should do at the other conferences. So it's very important that we get feedback. And that's it in terms of the housekeeping. In terms of Dr. Klafter, I think any of you who've read his postings on the listserv or heard him speak can really only be captivated by the wonderful, creative, and compassionate way that he focuses on treatment and focuses on his patients and clients, and it really is a privilege to hear from him today. Some biographical information about our wonderful speaker is that Dr. Klafter was recently appointed director of the Advanced Psychodynamic Psychotherapy Training Program at the Cincinnati Psychoanalytic Institute, as well as director of psychotherapy training at University of Cincinnati Psychiatry Residency Training Program. Dr. Klafter received his medical degree from State University of New York, and he completed his specialty training in psychiatry at Thomas Jefferson University Hospital in Philadelphia, where he also served as chief resident. He completed his psychoanalytic training at the Cincinnati Psychoanalytic Institute, and Dr. Klafter maintains a private practice in psychoanalysis, psychotherapy, general psychiatry, and psychotherapy supervision. He resides in Cincinnati, Ohio, with his wife and 4 daughters. I present to you Dr. Klafter.
Thank you, Simcha, and thank you to Nefesh for this chance to share some of my work with all of you today on dreams. So the title of this is A Lost Art, and my sense is, as a psychotherapy supervisor in teacher psychotherapy, that fewer and fewer people in psychotherapy work with dreams. In fact, I think it's probably more than half of therapists practicing today, I would say, never intend to work with dreams with their patients. And I think that far more than half. That's my estimate. Going around the room, this might not be a representative sample, but I certainly have supervised many therapists that come from very good training programs, who are very talented therapists and have absolutely no training or experience working with dreams. By a show of hands, how many here do not work with dreams? Yes, I think that's a little bit more than half of this room. I think that that's typical. And the intent of this presentation is to be practical and not theoretical. Anything I discuss that's theory is only for the sake of being able to make it more practical. The way that I like to lecture is also that I like to be interrupted as I'm talking. So raise your hand, and a few of you that get very enthusiastic about that, I'll move us on. I'll be responsible to keep the presentation going, but I don't need all questions to be at the end. They can be as we go along. Even though it's a very small room, I'll repeat your questions so that people listening to this on tape will understand what we're talking about. I'm going to skip through my biography because Simcha summarized it. Okay. What do people see in this image right here? Okay, I hear buffaloes, congregants from former community, Pharaoh's dream. Pharaoh's dream, right. So this is Pharaoh's dream. Okay, now I'm going to show another dream that this group might be less familiar with. Anyone know what this is? This is also a dream. Who did you say in Rome? No, not Dionysus. It was a Greek figure. This is an historical personality. This is the dream of Constantine. Constantine, and these are two dreams that have totally transformed world history. Now, I'm not going to bother talking about Paro's dreams, because I think you all know about Paro's dream. Constantine's dream, Constantine, who was the pagan emperor of Rome in the 4th century, he had a dream of an inverted sword. He was a great warrior, and he had a dream of a sword that turned upside down. And what is a sword that looks upside down? What does a sword look like if it's upside down? It looks like a cross. And he thought that that was a prophetic vision to transform Rome into a Christian nation. And that's how Rome became Christian, actually. It started with his dream. So these are two dreams, Lahavdil, that totally transformed world history. And I'm mentioning that just because of the fact that, that's how powerful dreams are. I mean, these are two dreams, two historical. Think of what happened in the world because of Paro's dream. Think of what happened in the Western world because of Constantine's dream. Yeah. No, no, I do not. I guess I will say this for the record. I absolutely do not believe that God sent a prophetic vision to a pagan Roman emperor, and if he did, it wouldn't be of a cross. But that needs to be clarified. Then thank you for the opportunity. But this slide will explain what you were just asking. Really, what transformed the world according to these dreams was not the dreams; it was the interpretation of the dreams. This is a famous painting. I forget now the artist's name, but I have it in my room upstairs. It was painted in 1894 of Yosef appearing before Paro to explain dreams. This is not the art scroll illustration of it, but there are many, many paintings of this event. By the way, this is a very, very favorite image of many artists to paint in the classical period. So, overview of what we'll do today in the presentation. I'm going to first present a model of personality and psychological problems based on internalization of relationships. And everyone's going to say, what does that have to do with dreams? I now put this at the beginning of almost every talk that I give because I think it helps set the context for what we're doing with any work, and we'll all be speaking a common language. And I intend for this model to be an integrative model in the sense that it would be relevant to behavioral therapists, cognitive therapists, and psychodynamic psychotherapists. And you'll see that in the model. I believe this is a model that everyone can work with, and it will also point out the different places in the model where those modalities of therapy intervene. Going to talk about the significance of dreams, an overview of dreams and dream interpretation, and I'm going to give some clinical examples, and we're going to do a group workshop exercise on the dreams with the clinical examples that I give, which means that we'll be, as a group, going through the dreams the way I believe it is helpful to go through dreams in psychotherapy, and so it will be a workshop in that manner. And my hope is that at the end of the presentation, those of you who are interested would actually have a very good head start in working with dreams and know what to do if you wish to add working with dreams to your clinical toolbox. So, to start with this model, I've been developing this model now for 13 years in my teaching. This is the current stage of this model. This obviously is a person, and what we are depicting with this illustration is that human personality is based on and develops through internalizations of relationships. That your personality, who you are as a person, is the way you have internalized yourself and other people interacting with one another. The myriad relationships you've been in, the early relationships are very, very powerful, but we all know that personality continues to change and adapt later through life. You and the people that you interact with, how you see yourself, how you see them, how you see them feeling about you, how you imagine they will respond to you, how you feel about them, all of that is what makes you the person that you are. I'll go on with some examples. And one example. This is a simplified example for teaching purposes. So we're going to give an example of a person with pathological shyness or the avoidant personality disorder. Let's imagine that this individual grew up in a home with two very, very busy, unavailable parents. And when this person, let's pretend it's a man, when he was a boy and he needed his mother's attention or his father's attention, he was always interrupting, and they were in the middle of very stressful activities, and he always seemed like he was annoying them, and it always seemed like they were too busy for him. And let's remind ourselves that when he was a child, his interpretation of what his parents did was immature and childish, because children are, by definition, childish. So he may have very much distorted what their view of him was. And we're not so concerned with reality. If his parents would hear him talking in psychotherapy, they might be very concerned about reality. It might feel like they were maligned. But we're concerned with what the living representation is in his mind of how people feel about him. And he has developed a sense of himself that he is annoying and people are too busy for him. That's the model that we're working with. And that happened through lots and lots of experiences where he developed that view of him and that view of how other people feel about him. That's what's inside his mind. Now let's talk about how this person reacts to people. I'm going to be following a model which is based on the work of Lester Liborski now. He developed a model called the Core Conflictual Relationship Theme, CCRT method, and that is a psychoanalytic but empirically validated model. It's actually very behavioral and cognitive, but it is a psychoanalytic model based on object relations theories. By the way, object relations theories, just to explain that mouthful to people, is the view of personality that internalization of relationships is what determines our personality. And in that, I'm just going to mention a few terms so you'll know them when you hear them talked about by other people, but we're not going to even use them today. The inside that head is the representational world of a person. And the representational world includes the self-representation, which means how you see yourself, internalized objects, which are other people, how they're represented in your mind. Another term for that is internalized object or object representations. And then the interactions between the self-representation, which is your view of yourself, and the imaginary other people that inhabit your mental space, those are the object relations, how you and other people interact in your mind. This is all imaginary. It was shaped through reality, it was shaped through your temperament, but that's what's going on inside. So those are the basic terms of object relations theories. So now we're jumping forward to the CCRT method. So what's in the head is just imaginary. That stick figure of a woman is a real person. And this man is about to have a relationship encounter with this other person. There's 3 stages to the relationship encounter, according to Dr. Liborski. The first stage is really prior to the encounter, and that person has a wish or a need. I should say a wish or a need. The next step to the relationship encounter is that before the person does anything, he imagines how that person will respond to his wish or his need. He hasn't done anything yet. Then the third stage, and we're going to give an example, it'll be even clearer. The third stage is the actual behavior. The actual behavior is not enacting his wish, he's responding to how he imagined the other person was going to respond to his wish. And Dr. Liborski has proven, with a lot of scientific reliability, that people have very characteristic relationship episodes that follow this model. So now I'll give a typical one. Again, it's simplified, but I'll give a typical relationship episode for this person. The wish is, I'd like to get to know her. That's his wish. I'd like to get to know her. Now, before I go forward, what do you imagine that this is, again, a person with pathological shyness or avoidant personality? What do you imagine his anticipated responses of the other person? What do you think his response will be? She's not available. She's too busy. She won't want to get to know me. She won't be interested in me. Right, that's what he'll imagine. So in case you're not clear on this, I didn't grow up in a house with parents like this, because I don't think anyone has anything better to do than listen to what I have to say. So I don't have that anticipated response. You all agree with that? That's clear, right? So that's the anticipated response. She's too busy to talk to me. So what will he actually do? How will he handle himself? What are ways that people with avoidant personality or shyness, how do they cope with this anticipated response? They're always imagining people are too busy to talk to them. So what do they do? Highly apologetic, dismissive of himself. Right, so, hello. He'll make it come true. He'll make it come true. He'll prove how insightful he is about other people. Right. So actually what I'm saying is that he just says, I better leave her alone. He does nothing. Now, here's one of the things that's hard to understand, because to outside observers, this looks so clear and so obvious. But to the person experiencing this is all unconscious. He's not aware of this happening. And it's strange because it seems so clear, but he's not aware that this is going on. In different people, how unconscious it is will vary, okay? And that may determine which modality of therapy you're going to use, exactly how unconscious it is. But it is not on his mind. He's not aware that he wants to meet her. He's not aware. He might have been for a fleeting second aware that he wanted to meet her and get to know her. He's not aware that he's imagining she won't have time to talk to him or she'll be too busy or uninterested. That's just sort of like, it's like a fish in water. Of course a fish is in water. A fish doesn't think about water. That's just his built-in assumption. It's no mental attention to him. And he doesn't have to try to not meet her. He's not biting his tongue to say hello. That's very, very natural for him. So he's not thinking about this. This has become his instinctual reflex. So, moving forward with this model, is anyone in this room a behavioral therapist? Okay. Where would you intervene with this man who is having trouble meeting women? Where would you intervene in the 1, 2, 3? Okay, so let me say what you're saying on tape. So, and that is what every behavioral therapist has said that I've presented this model to, that behavioral therapists intervene here. The pathologic behavior is that he won't meet anyone. So behavioral therapist, the first step might be, this is what I want you to do. I want you to smile at someone that you think is interesting. I want you to spend your lunch hour walking around looking for someone that you find attractive or interesting, and I want you to nod or smile. The next step might be, I want you to invite a coworker to eat lunch at your desk or at their desk. Or going down the line, there will be progressively more engaging behaviors that are prescribed by the therapist. Smile and say hello. Okay, well, you're a better behavioral therapist than me. But there would be progressive steps which would enact greater contact with somebody, and that's where the behavioral therapist will intervene. Yes? This person comes into therapy probably for depression or loneliness or anxiety. That's what I would say. Most people that I know come into therapy for depression, loneliness, and anxiety. Most of my patients do. Or they come into therapy, if it's a more insightful patient, they come into therapy recognizing that their lives are not on track with where they think they should be developmentally, but that's a more insightful person. But that's what I'd say. This person comes in with depression, and only in talking to this person do you realize how unsatisfying the life is. Because this person, I don't even think, would necessarily be able to say, I'm very lonely and I think that's why I'm depressed. I'm not even sure that that person would put those two things together, which again, for us is strange. Well, we're therapists, so hopefully we understand that. But for outsiders, it's strange because it seems so obvious. But for this person, it's such a painful issue that he's managed to keep it off his conscious mind. Janice.
But I don't even know how you would, to me, I can't imagine intervening at the behavioral level because this person doesn't even recognize, that's a later stage to me to help somebody understand.
Okay, so you can't imagine intervening at the behavioral level, and I'm not going to let the behaviorist respond because I want to move on, but that's why you're not a behavioral therapist. Okay. Is there a cognitive therapist in the room? You were a behavioral therapist a second ago. Okay, that's not my point, though, for teaching. A new person, cognitive therapist. Judy, you're a cognitive therapist. Judy, you are the most eclectic therapist that I know. I'm going to not even let you answer this question. That's what I think. Is anyone here a CBT cognitive therapist? I love this room. You are to some degree. Okay, two people here will admit it in front of me. Where would you intervene in this set of problems? Where is the best opportunity that you see? Challenge what thoughts where? In this model.
Okay. To have them happen to you. In other words, how do I think? How does the next person look at it? What is the wise mind doing? Challenge and what, take yourself out of the picture. What would you see about yourself?
Okay, but I'm asking you, this is a multiple choice test, not a short answer test. Here are your choices. Here's your choices. They are the stuff inside the head, 1, 2, or 3. Which one? Where do you intervene?
I say inside the head.
You would intervene inside the head. Okay, that's interesting. That's not the typical answer of a cognitive therapist, but that's an interesting answer. In the back, he beat you to the punch. In the back, you would intervene with 2. Because that's a distortion. She's too busy to talk to me is like, so it's not that a cognitive therapist doesn't think everything else is relevant, but most cognitive therapists see that as the most accessible, distorted thought causing problems. So that's like a great, efficient opportunity to intervene. That's how a cognitive therapist will see this. And I'm sorry, they matched my slide. That's why I have to say the right. But now I think that cognitive therapists who work on who do schema work do intervene inside the head, and that may be why you said that you intervene inside the head. But I think that schema work is psychodynamic psychotherapy. So I think that then it gets to be very difficult to distinguish between what the modalities are. And I think that psychodynamic psychotherapists try to intervene inside, and they're trying to change the self-representations and the object representations and the object relations. That's what schema work is also. Inside is the schema.
But before you can change it, you have to create the awareness of it. That's where you start.
I'm not talking about how, but I'm saying the overall strategy for where people in this model, the technique of how to do that will be different between each model as well. The behavioral therapist, I think, is not all that concerned with insight because behavior is what will bring about emotional change, according to a behavioral therapist. Maladaptive behaviors have to be unlearned. And the unlearning of those behaviors is a learning process. It's not an insight-oriented process. It's a behavioral learning process. Cognitive therapists are concerned about insight, but they see the best place to start where there's a really distorted lack of insight, and that's the most efficient place to start. And I think that psychodynamic psychotherapists, their view is that we really want the person's inner subjective experience to be what we work on and change, and that will be the basis for which everything else will flow from in a healthier way. That's how I think. But I do think this is a model that works for most people. I think most therapists are comfortable with this, and it represents how they work. Yes?
I would just say that this is
A beautiful EMDR case. Okay. I'm not including EMDR in my talk for now. Okay. She can explain why if we have time at the end. Or she can give a talk at Nefesh next year. She can explain why. So, no, I'm not against EMDR. I just haven't put it into my talk, that's all. But EMDR, okay, there's a lot of pressure. I have to do what Judy tells me.
You could help me, but I would say that going back and taking a very early history, starting at, focusing on like 4 to 7, you would pick up some of this stuff and then you would target that. You would go to those places.
No, but this is your lecture, but why not?
No, but these are people who are saying, why would you? And I think you need to have some familiarity with the way in New York EMDR works, but it just goes so much more quickly. Not that psychodynamic therapy is not the right,
But
other right.
excuse me, every good therapist does a good interview.
Yes.
Why not?
I'm not knowledgeable enough about EMDR to talk on it.
Just briefly, it is available to use for even these kind of cases. It's not trauma, and it works very quickly, and it's very powerful. That's all I would say.
I just want to say something. I happen to have a lot to say about EMDR in a positive way too, but I think we're losing the focus over here. Nachum's talking about dreams, and he wants to just give you a basic representation of how he views the whole personality, so when he talks about dreams, you'll understand what he's talking about. There's probably 16 different interventions
That I also don't know about.
that might
Right.
be helpful to the client.
These are the 3 modalities of therapy I know about.
His insight into dreams
Okay.
and how to use it.
And also why dreams would inform people working in other modalities. That's the other thing. Okay, so I'm going to move on. What is a dream? Okay, what is a dream? So a dream, from a physiological perspective, neurophysiology, a dream is bursts of electrical activity in the brain, mostly during REM sleep. There are dreams that occur in other phases of sleep as well, but mostly during REM sleep. That's physiologically what a dream is in terms of just biological phenomena. But when we say the dream, what we really mean is we mean that these seemingly random electrical discharges are experienced by the dreamer as a series of images, emotions, sensations, and narratives. That's the dream. So that's what we mean by a dream. There's a biological event going on in the brain, and it's experienced, again, it's a series of images, emotions, sensations, and narratives. So that's what we're talking about when we say a dream. All evidence suggests that dreams are universal. And when I say universal, I mean like 120% of people, not just 100% of every single person dreams, we believe. Recall of dreams is not universal. There are people that have no knowledge of their dreams, but we believe that all people dream. In fact, there's a lot of evidence that all mammals dream. A lot of evidence. It's very hard to prove, but there's very convincing evidence that all mammals dream. If anyone has ever seen the movie The Bear, did anyone ever see the movie The Bear? It's a wonderful movie about a bear's life. It's filmed in France. And it was very interesting because it portrayed dreams of this bear and the bear's deceased mother. It was a very interesting movie. But there's a lot of evidence that mammals dream as well, other mammals. There are certain techniques that can change our memory and access to or control over our dreams. They're things that people can do. Dream journals, discussing dreams in psychoanalytic treatment. There are lucid dreaming exercises. There are things people can do to sort of change their dream life. There are physiological factors that affect the amount and characteristics of REM activity. For example, people that are sleep deprived for a long period of time, the first thing that happens when they restore their sleep is they have lots and lots of REM sleep, more than usual. The term for that is REM rebound, if anyone's heard of that. So the phase of sleep that dreaming occurs will be overrepresented in the sleep following a phase of sleep deprivation. There are certain drugs that increase REM activity and make the dreams very, very vivid. There are certain drugs that will suppress dreams. In fact, one of the treatments now for post-traumatic stress disorder, which I think is an absolutely terrible treatment, by the way. I'm against this treatment personally, but it's to give people anticholinergic drugs to suppress their nightmares during PTSD. I think it's a terrible, terrible treatment for PTSD. It doesn't treat anything, it just suppresses their dreams. It actually interferes with getting through trauma. Right, but that is a treatment, and it does reduce nightmares. So some people find it helpful to reduce their nightmares. So there are things we can do to change REM sleep, but what really determines the meaningful aspects of a dream is individual psychological factors. That term determines the nature of the images, the emotions, the sensations, and the narratives. In other words, this electrical activity, you and I are having the same electrical activity basically at night when we sleep, but my electrical activity is experienced differently by me, not because it's different electrical activity, it's because I'm different. You know, we're all putting a different movie to this energy, this psychic energy at night. Yes?
Once you open the box of electrical activities, are there studies to know which circuits are available? I guess is this, basically very, very good institution that we know sort of what's really active, what part of the brain is really active during REM sleep?
The question is about whether the answer is I don't know the answer to this, but is there literature or studies that looks at the precise circuitry that's activated during REM sleep and trying to link that to different experiences in dreams? I don't know of it, but what we do know is we know that most people, basically have very similar electrical activity during REM sleep, and they also respond to physiological events in similar ways. Stimulating medications will make everyone dream more vividly. Anticholinergics will make everyone dream less. Other sedatives will make people dream less. But what affects your dream are things in your life that are very particular to you. So it's the unique experience of your REM activity. That's what makes the dream your dream. We're not really that concerned with the physiology when we interpret dreams. That's what this slide is supposed to be about. What we're concerned with is the actual emotions, sensations, and narratives and images that you have when you're dreaming, regardless of the electrical activity behind it. Yes?
Can you say something about the way alcohol, marijuana, and Ambien and the other sleep medications affect dreams?
Well, alcohol, Ambien, and marijuana, alcohol suppresses dreams. Marijuana, I'm not really sure. It probably suppresses dreams, but I'm not entirely sure what marijuana does to dreams. I know more about what marijuana does in one's waking state. And Ambien, Ambien, I'm not sure what it does to dreams. It makes people sleepwalk and do a lot of very bizarre things in their sleep, but I don't know what Ambien does to dreams. But the impact of sleep medications on dreams is probably significant because you're changing sleep architecture. Wellbutrin makes dreams very vivid often. The Rosarum, which is a melatonin analog, makes dreams very, very vivid. There's some people that can't tolerate it because they have such vivid nightmares. So again, the significance of dreams is in the meaning of the images, the emotions, the sensations, and the narratives. That's what we are concerned with in people's dreams. I want to talk about primary and secondary process. These are terms from, these are old terms. These are terms that are about 100 years old. Primary process, okay, start with secondary process. Secondary process is the thought patterns typical of adults in a waking state. So as you're sitting here thinking about things, talking to me, listening to me, responding to questions, the way you think when you are, as an adult, interacting with people logically, that's secondary process. And the characteristics are the following. It's logical, it's chronological, it's mostly consistent with reality. There's a lot of abstraction. You know what I mean by abstraction? You're thinking in concepts with words, verbal, and that's much more than sensory experience. Right now, your thoughts in a dialogue, it's much more about what you're attending to are verbal concepts, much more than subjective sensory experience. Primary process are the thought patterns seen in children, psychotic patients, and dreams. Primary process, it does not conform to reality. It does not observe the laws of logic. Time, space, and gender are not fixed in primary process. Primary process can be very evocative, frightening, chaotic, or confusing. It's visual, tactile, olfactory, and auditory primary processes. And there's a phrase, there's no not in the unconscious. What does that mean? There's no not in the unconscious. It means that the unconscious mind, the aspects of your mind that are governed by primary process, you can be in two places at once. Something can be true and not true at the same time. Two things that are mutually exclusive can still be believed at the same time. The laws of logic don't apply. Nothing's really prohibited in the unconscious. So dreams, is there a not with a K? I would need to know what the nimshol is, and then we'll talk about it afterward. I don't know what the nimshol is.
Like a traffic jam in the flow of the, let's say it's not nightmares, it's optimistic dreams, it's hopes, it's prayers, it's not only negative.
Well, dreams are not. It's true that dreams are not only negative, and right now I'm talking about primary process in general, but even though dreams are not only negative, dreams are usually about thoughts and experiences and emotions that for some reason you're not allowing yourself to fully think about in your waking state. So dreams usually have an aspect to them that are uncomfortable. It's something that you wouldn't allow yourself. I mean, according to this view of dreams, we think that if you could just fully know something in a conscious state, there'd be no reason to have a dream about it. The dream always presents elements that you're not aware of in your normal conscious waking state. So it should be right. There should be something unnodding in the dream. There should be something in the dream that you really do not know. If you know everything that your dream's about, you probably don't understand your dream. We think that there are always hidden dimensions to dreams. That's what the dream is. It's things that you wouldn't be aware of. Now, so this verse we all know by heart, B'shuv Hashem es shivat Zion hayinu kecholmim, that when Hashem will return the dispersed exiles of Israel to Zion, to Zion, we will have been like dreamers. And it's a very puzzling pasuk because the tense has changed. So one very interesting taich I heard of this is that when in the Yemos HaMashiach, we will look back at the exile, and the exile will seem like crazy the way you wake up from a dream, and your dream seems so crazy. But in your dream, it seemed real. Like I remember very often when I was in residency, I had a dream, I would have a series of dreams that I was in bed in the Market Station train terminal in downtown Philadelphia. And I was trying to sleep there, and all these people were walking by, going to their... And I was so annoyed. I was trying to sleep. You're disrupting my sleep. And I would be pulling the covers over me more. But that's where my bed was, and it seemed totally normal. And I was very upset that I'm not going to get enough sleep because my bedroom is in the train station, and it seemed totally normal. And I'd wake up from the dream. Of course, that's absurd. You can't have a... My bed is not in the train station in downtown Philadelphia, but in the dream it feels totally normal. And so that's like the idea of primary process. Primary process feels crazy only when you're operating in secondary process, but when you're immersed in primary process, your primary process mind, it seems fine. I mean, and it is a component of all human experience. All people have experiences that are governed by primary process. But the logical adult part of you does not really allow a lot of access to primary process because you'd be overwhelmed by psychosis, basically. Any questions about this? Is this a term that people know? Does anyone here has never heard of primary process before this? So yes, some people have not heard of it before this. Dreams are governed by primary process. That's the connection to dreams. So that's the first thing to note about dreams is when you listen to dream material, it will sound haphazard and crazy. It isn't. It does have a logic to it, which we're going to go over a little bit today. But it's so different than life experiences. Most dreams would be things that are impossible in reality. Yes. There are definitely dreams that, especially briefer dreams. There are some dreams that are like really brief that are not impossible and seem to be logical. But many dreams are also impossible and illogical. I remember a dream I recently had that I was walking and my shoes they were very sharp shoes and they were cutting into my feet, like right under my ankles, and it was like I had blisters and I was bleeding. It was very hard to walk, and that was it. That was the whole dream. There's nothing about that dream that is really illogical. What I think was going on inside of me when I had the dream was very meaningful, which I'm not going to share with this group. Right. Right, not yet. I hope there's not a hypnotherapist in the room. So there are dreams, but what's difficult about dreams is when they're governed by primary process. That's when interpretation of dreams seems so difficult because it seems so chaotic and illogical. Yes. Yeah, I think it's just exaggerated during. I think that's right. That psychotic patients and children are already thinking in primary process. But yes, I think it's. Although it's also sometimes just an extension of primary process. There are some psychotic patients that cannot tell the difference between their dreams and their reality. I mean, I don't want to spend a lot of time on this, but a better definition of psychosis would be a person that cannot distinguish between his imagination and fantasy life and reality. That's a better definition of psychosis than delusions and hallucinations and disorganized speech. When you walk down the street and you see someone that resembles someone you know, let's say I'm walking down the street in Philadelphia and someone looks like Simcha. For a moment I say, is Simcha in Cincinnati? And then I see, oh, that's not Simcha. It's just someone that bears a resemblance to Simcha, another very well-dressed, handsome man. So let's say that I were psychotic. What would I say? I would say Simcha's body was invaded by an alien, and I'd be very worried about Simcha. That's how a psychotic person would think. In other words, that flash of, oh, I think that's Simcha, I test it with reality, and I know it's not Simcha. A psychotic person doesn't do that. That's what psychosis is about. So a lot of psychotic people, their dreams and their waking state, they can't tell the difference between them, and some children are like that too. And I'm sure all of you have had the experience where you've had a dream and you're not sure if this conversation happened in a dream or in reality. I mean, many of us have had that experience. So there is some continuity, and I think with children psychotic patients, it's more exaggerated. So the question is, how is this in terms of nightmares? There are people that try to give technical definitions of what a nightmare is versus a dream. And I don't really believe that. I think it's all sort of very arbitrary. I think a nightmare is just a dream that you find very, very disturbing. I think that there are dreams that you could have at the beginning of psychotherapy treatment when you still suffer from a lot of anxiety and there are a lot of things that you're afraid to know about yourself. And I think you could have the same dream at the end of a really successful therapy treatment. It would no longer be so frightening to you. I think it's just the subjective horror or discomfort with certain things that are revealed in a dream makes it a nightmare. So I don't think it's a technical definition really. Yes. No, I think that, no, I wouldn't say that at all. The comment was there's no such thing as good dreams according to what I'm saying. Let me make myself clear. What I want to say is that, I'm sorry if I can see why you would have concluded that. There are aspects of things in all of us that are kept unconscious because it's disturbing to acknowledge. If I have, really angry feelings towards someone I love, that for healthy neurotic people like all of us in this room, okay, it's very painful to have angry feelings towards someone you love. It's very, very painful. If you're very disappointed in your child or your spouse, it's a very painful thing to feel that. And so a lot of that feeling will be kept unconscious. It may be represented in the dream in a certain way. It could still be a pleasurable dream, actually, and you could still have pleasure and enjoy the dream, but there's some emotion or feeling or thought inside of you that you're not able to fully acknowledge in a conscious waking state, and so it gets represented in this distorted, imagistic way in your dream. But it can still be a pleasurable dream. But there must be something conflictual in order for it to be in the dream. But things that are conflictual can still be very pleasurable. So you can have very, very good dreams about something that's highly conflictual. But a nightmare is just that I found it terrifying and horrible. Yes?
The whole kind of daymares. Living with horrible things can make daymares. When you daydream, doesn't mean it has to be a good thing.
Right, and daydreaming is when you allow yourself to have sort of a free-flowing consciousness, like what a stream of consciousness. Your stream of consciousness in daytime is not as primary process-oriented as a dream is, but it's freer than logical thought, and that's what daydreaming is. But daydreaming is, just the whole term daydreaming it's a metaphor from dreams. It's sort of like this series of thoughts I had while I was awake. It resembles a dream in some way, so we call it a daydream. But it's not the same thing as dreaming. Dreaming when you're asleep is a different thing than a daydream. I'm going to move on. Okay. What do people see in this image? This is a painting by Kandinsky, by the way. What do people see in this image? A lot of color. One person sees a guitar. Some sees a face with on the left side with a door. What was that? You see a lion.
Geometrics in the front, more rational logic, taking order, and more chaos in the back. More
You're interpreting. I just want to know what you see. No interpretations. Just what do you see? A robot. And you do see geometric shapes. Right. Yom V'Laila. Darkness, light. And I have to be tough on you too. I was tough on her. It's unfair.
I was just free associating.
Free associating, and order and chaos was part of your free association. You see order and chaos in here.
Sure.
Okay, so anyone else see anything with this?
Vibrancy of color.
Vibrancy of color. Okay, tell us more now. We're going to move into the interpretation mode. Tell us more about the order and chaos that you see.
Oh,
Go ahead.
In order, frontal lobe stuff is logic, containment, the lines, that kind of thing, making sense of the world. The back is emotional and free-flowing and squiggly. I see all kinds of Rorschach things. I see a heart. I see lots of things.
Okay, so this is
Of emotion and
this is a painting that this is one of my favorite works of art in the world, and I actually have a print of this in my office, and I see this painting for hours every single day just because of where my chair is in my office. So this is something I'm looking at all day long in my office. So what I see in here, which is similar to what you're starting to say actually, is I see a person's chaotic primary process mental life in the background, and I see a window into his mind through the door with the flash of insight in that light bulb above the door, and I believe that he's speaking. So I think that this is like a psychoanalytic or psychotherapy illustration. That's what I see here. But the idea I wanted to represent with this is that it takes a while to make sense of this. You can't just look at a painting like this and get it. You've got to start to let yourself experience the images, think about the images. You might be quicker than some of us to go with that right away, but you were hearing other people's things. You have to let the meaning kind of emerge to you over time. And that's what a dream is like. A dream is a set of, it's like looking at this painting and trying to make sense out of it. I mean, I've literally been looking at it for hours every day for 5 years. I've been in my current office for 5 years. So it's taken me 5 years to tell you what I just told you about this painting. That's what dreams are often like. They're full of chaotic stuff, and you have to be patient and let yourself kind of play with it and work with it for a while. And you will start to make sense of dreams over time of your patients. But that's what I wanted to capture with this exercise. Yes?
Yeah, I just want to ask you, since you watch this or see this as as the backdrop in your office all the time, do your interpretations of it change over time? Either with regard to the particular patient that you're in or with your own internal stuff?
I don't know if I'm paying that much. The question is, you're curious to know, does my interpretation of this change over time? I don't know that I've thought about it so carefully, but yeah, I think it changes over time. I think it also deepens and sharpens over time. I think over time there'll be more elements that I'll fit into that interpretation. I think that it'll become more and more detailed and developed over time. But it would certainly change. And look, it's very biased because of the fact that I'm a therapist and an analyst. So you can see how much my interpretation of it is colored by that aspect of me. And that's why I have it in my office, because I think that's what the painting is about. I'm going to talk about some dream elements. The manifest dream. The manifest dream is simply the report of what the patient has experienced. I guess, technically speaking, the manifest dream would be exactly what the patient experiences. When you hear a dream, it's already revised because you're getting the patient's recall of the dream. And recall is also, the dream, again, they were experiencing what's going on in their sleep, and they're telling you what they make of that experience. So it's already revised when you hear about the dream. But the manifest dream is the series of images and emotions and narratives. That's the manifest dream itself. The That's right. That's right. So you're clarifying what I said, and you're correct, that when you hear a patient report a dream, you are hearing a revised account of their dream experience. You're not, only the patient had the manifest dream. So the best you're going to get is a revised version of the manifest dream. What you will see happen when you work with dreams is that patients will start to remember more about the dream as they're telling it to you, and they will unrevise their dream and say, actually, this is what happened. Or they will also tell you, there's a part of the dream that I didn't feel comfortable telling you, and this is what happened in that part of the dream. You'll see that as the discussion of the dream unfolds, they will start to have sometimes a more full and accurate account, less revised. But it's still revised to some degree, because no one can give over such a subjective experience. It's being translated into words. A couple puzzled looks in the back.
I don't know if this has anything to do with dreams in particular. Isn't that human experience in general is related to another, particularly the therapy experience of unfolding your internal world? You have an internalized subjective experience that you're then modifying, changing as you give it to the other, and over time the comfort, the relationship, interpretation, that will change. Is there something particular you're trying to address with dreams?
Yeah, okay, so that's a very important question. So your point is, manishtana, that basically any experience that I share with you is a revised experience because it's gone through your subjectivity filter. So that's true. I think there is something special about dreams that's different from that. If I tell you about a conversation that I had with my daughter, I'm making an effort to give you, as best as I can, an accurate account of the conversation. If I had a tape recording of the conversation, that would be even better. I would play the tape for you. What I'm trying to do is do the best I can at play a tape or video of our conversation. I'm trying to do that. We know from a lot of memory experience that's impossible in human beings, but that's what I'm trying to do. When you have a dream, it's almost like if you had an acid trip and you're going to explain your acid trip to somebody. You're explaining something that is a highly personal, subjective experience that is how these electrical impulses got translated into smells, sounds, sensations, images, a narrative. And so it is so already subjective to start with that it's a different activity. You're not trying to relate external events and recall them. You're trying to share inner experience in the first place. So I think it's a different activity. When I tell you my dream, I think that is wholly different than if I'm testifying in court about what I saw take place on my front lawn. I think it's just a different activity in the first place. But yes, you are correct, I think, that that's true, ultimately evolved. That's a limitation of the human senses in general. But I think you're trying to do something different when you relate a dream than when you just talk about events that occur, external events. The latent dream meaning is the emotions and feelings and anxieties and wishes and impulses and conflicts inside of you that got represented in the manifest dream. That's what the latent dream meaning is. And so this other term, which comes from Freud, dream work, the dream work is the symbolic representation of those unconscious wishes, feelings, and fears in the form of a dream. Like, how did that happen? What was like the process that all those things got symbolized in your dream? That's what we call the dream work. And we'll talk about elements of dream work. It's a confusing term because the dream work is not the psychotherapy work with dreams. The dream work is like how the dream was constructed inside the person's mind. So one of the things that as Torah Jews is easier for us to understand than a lot of other people, actually two things, metaphor and metonymy. These are two important components of dreams. Metaphor is when we represent through an image or through a story or through a parable or through a tale, through something, a very complicated, subjective, emotionally laden concept or issue or idea. It gets represented in a story, in a song, in a symbol, in a sound. That's what a metaphor is. That's right. Midrash, Agada, those that study Midrash, I think, have an advantage to interpreting dreams. I also think people that work with dreams become more adept at deciphering Midrash as well. It really is a very similar process. There's a book called The Juggler and the King. The Juggler and the King is an English adaptation and translation by Rabbi Aaron Feldman of a book by the Vilna Gaon, it's a rare book that we're lucky we even have in our possession nowadays because it was out of print. The book by the Gaon is called Biur al-Kama Agados, just an explanation of a few Agados from the Talmud. And there you see the Vilna Gaon's way of deciphering these cryptic parables in the Gemara. It's so complicated. And Rabbi Feldman said he spent years of his life trying to figure out what these mean, and he got most of them. There were some that he really couldn't understand, and he spent years and years trying to understand it. And it's very similar to dream work. I mean, it's more difficult than dream work because you have to be versatile in the entire rabbinic literature. But it's a very similar process of interpretation. Metonymy is a type of metaphor. Metonymy is when a part of something is used to represent the whole of that thing. For example, if you would say, we need boots on the ground. What is boots on the ground? What does boots on the ground mean? It's an English expression. It means soldiers, but the boot stands for the soldiers. So dreams have in them metaphor and metonymy. A little thing will represent something much larger than it. That's two important parts of dream work. Condensation is another thing that happens in dreams, where there could be a person in my dream that will represent my wife, my father, my friend, my daughter, and a colleague all at the same time. Several people at once, or several things or concepts or issues at once, will get represented with one very thing at the same time. I think it's the opposite of distillation. I think distillation is when you have one thing that gets split up into various components in a dream. Right. Displacement is when you have something symbolized in a dream in a way that's not such a direct representation. It's thought to be a defense that's working even in the dream. Verbal puns. There are certain dreams that the whole dream seems to be wound around a verbal pun. And I'll give some examples of that as well. But there are dreams where, like the whole dream, to get the dream, you have to get the pun of the dream.